Now we will go into the practice of expanding the fourth section of our lungs. This is brought about by keeping again the hand position in a particular way. Here we have to keep the shoulder blades as far away as possible so that there is enough space on our backside for the lung to expand. Not only that, we should close the front portion to the extent possible so that the entire inhaled air goes for expansion of the backside. That is brought about by keeping the hand in this way. That is, we must keep the shoulder blades as far away as possible. That means we have to do like this. When you do like this, the shoulder blades are away from the spine. There is enough space in the back for the lungs to expand. Not only that, by keeping the hands crossed in front of our chest, we are sort of obstructing expansion taking place in the front. So that is the idea. So now keeping the hand tightly like this, we will do about 6 or 7 breathings. In, out, 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 relax. So we have so far completed exercising 4 sections of our lungs. One, through abdominal breathing, we have expanded the lower portion of our lungs along the last rib. In the second, we did the thoracic region, that is the chest region, expansion. Consciously not expanding the stomach, but expanding only the chest was the second exercise, second portion exercised. In the third portion, we exercised the frontal portion of our lungs totally by giving maximum space in the front for lungs expansion. For that, we kept the hand like this. In the fourth section, we expanded the backside of the lungs. For that, we covered the front side like this so that the shoulder blades are as far away from the spine as possible, and took about 7 or 8 breathings, allowing the back muscles and the portions of the lungs to expand. These are the 4 sections we have demonstrated so far. Now 2 more sections remain. The left portion of the lung alone expansion, that is the right portion. The right portion of the lung alone expands. The last is left side of the lung only expands. How do we bring about that? For this, we keep the hand fisted like this and cover the right side. This is the right hand I'm using. So this is the central sternum and I'm keeping the hand position along the central sternum, and the hand forms a V shape. This is the expanded lung shape. So this is the shape of the lung. Now, keeping this forearm pressed against this right chest and these elbows pressed against the last rib, we are sort of compressing the right portion of our lungs. So there is only left portion available for the inhaled air to expand. So this is expansion of the left lung portion separately. Now keeping this hand like this, pressing the elbow against the last rib. Now we take about 5 or 6 breathings. Inhale, out, in, out, in, out. Mentally direct the inhaled air to go to the left side. If you mentally determine to send the air to this side, air will automatically go to this side and you will be able to observe the expansion taking place on your left side alone. Observe that expansion. First few breathings you may not have been able to observe. As you proceed, you can definitely observe after 5th or 6th inhalation exhalations. Yes, inhale, expand the left. Breathe out, inhale, breathe out, inhale, breathe out, inhale and expand the left. Inhale, breathe out, inhale, breathe out, relax. In the same way, we will now expand the right side separately. For that reason, keep the left hand like this and close against the left chest. The forearm pressed against the chest and the elbows pressed against the last rib. And now inhale. Now only the right side will expand. Inhale, breathe out, in, out, in, out, in, out, in, out, in, out, in, out, relax. So that was sectional breathing. We mentally divided the lungs into 6 different regions and exercised individually each region through separate exercises. This is only a preliminary exercise. This Sectional breathing is only a preliminary exercise, and we have a few more preliminary exercises which we will be showing in the next video, second part of the video. Totally, we intend showing about 3 types of preliminary exercises which are in the nature of warming up exercise before going into the serious practice of pranayama. So with this sectional breathing, we end today's program. So we will end the video now, and we will meet again tomorrow in the second edition. Thank you and bye till then.